So, first time with me, and you're here for facial
Yes.
stuff and also body
Yes.
stuff too. Okay. So I'm going to go through a little talk about how I approach things. This is the Roxbury Institute, and I founded this several months ago, and it's a comprehensive approach to the patient, from both the outside and the inside, to combining both aesthetics and kind of health and wellness. And it's about super specialists in a different part of the Roxbury Institute. It's about treatment plans. I very much believe in that in terms of setting up a treatment plan for a patient, not just a patient coming in saying, I want to do this, I want to do that. It's all about a proper plan. So when I look at somebody's face from a standpoint of changes that take place as time goes on. Now you're young and pretty, but we start to see little subtle changes as time goes on. I can't categorize the changes to different areas. It's a very important way to look at this, in this area of rejuvenation of the face. The first area are expression lines, things that form because of muscles of facial expression, and this is where we use things like Botox or Dysport to relax that. Number two is gravitational changes of tissue. As we age, things tend to want to settle and drop. And here we're doing skin tightening procedures using a bunch of different devices that we have over here. Or sometimes if somebody has gone on in years, sometimes it involves a surgical tightening procedure, which is not the case in you. Category 3 is loss or shifts of volume. It's a very important area. As we age, we tend to lose volume in the face. Either we lose it locally in certain areas, or we lose it more globally in the face. And this is where we use things to recontour the face. I like the term recontour as opposed to filling, because it really is that. You're not just filling the face up. You're using materials to contour the face, improve contour. And the last area is the skin itself. Wrinkles, sun damage, color change to the skin, either red or brown color changes. This is where we either do, first of all, home skincare products, or lighter treatments, either peels with the esthetician or lighter lasers, or sometimes more aggressive treatments in terms of improving the skin itself. So think of those 4 areas. So let's start by looking at area number 1, expression lines in the face. So this is where we use things like Botox or Dysport to relax.
Okay.
The common areas are this area over here. Go ahead and scowl for me. So there is a little of this going on. Do you get Botox done at all?
Yes.
Okay. So I can tell you probably do, because this muscle is not very strong. But when did you have it done? A few months ago?
No, it's been, I think, like 7, 8 months.
All right, so this muscle is pretty much back in terms of function. So this area, I think it's worthwhile to do Botox to relax that. Big smile. So this is another area for Botox. You really don't have much going on over here, quite honestly. You know, if we're going to use Botox here, it's just really done for prevention and maintenance in your case. Have you had it done here before?
Yes.
Okay. Were you happy with the results?
Yeah, this one seems to always come back.
Big smile? Okay, so, you know, I do think it's worthwhile to do over here. It's going to help prevent lines from occurring. Raise your eyebrows. Personally, there's not much going on in your forehead. I would really leave your forehead area alone. You know, there's very little going on over here. Let's move on and gravitate to the gravitational category. So, you really have very little going on here, almost nothing. You're nice and tight in your eyebrows. You're quite tight over here. You've got a nice strong jawline. You're very good under the chin area. You really don't need to have anything done. You look quite good in that, from that standpoint. Where I do see an important area is facial contouring. Okay, this is an area I take a lot of pride in how I go about evaluating and doing it. I look at a number of things. I look at bone structure. I look at symmetry and asymmetry in a person's face. Like right away I can see that the right side of your face is a little more straight up and down. The left side of your face is a little bit lower and rounder. I look at the middle part of the face as one unit. I look at the lateral part of the face and how it contributes to it. I look at light and shadow a lot. Light and shadow to me is very telltale. It's what we see when we look at a mirror. We look at a picture of ourselves. So as I look at your face from that standpoint, I see this central facial area here that it's gotten a little bit flat. That we start to see a little bit of this dark shadowing under your eyes over here. Take a look along with me. So this dark shadowing under your eyes. There's a little bit of shadowing here, a teeny bit in what we call the oral commissures, but you're also losing a little bit of support and structure in the upper cheek area. I'd like to see the face start to take on a little bit more of a heart-shaped look. It's a little bit straight up and down. Bite hard for me. Okay. Do you clench or grind your teeth?
I'll
Nice
clench.
times. Okay. So I can tell that because I can see some of this fullness in the jaw area over here. And when you bite down, you see that bulge out like that?
Mhm.
That's your chewing muscle, your masseter muscle, which has gotten to be quite strong. And so by doing a little Botox over here, it's going to relax that muscle and bring this area in to create a little more of a softer look to the lateral jawline area, as well as a little bit of lifting and filling it in the face to create a little more of a heart-shaped look to the face, because you've got a nice strong jawline, but it's a little bit straight up and down. So very quickly, what I'd like to do is a little bit of Restylane under the eye area, use a product called Voluma in the cheek area to support and lift, do some Botox in through this area to relax, and a little bit of Restylane in these areas over here. Lastly, the skin itself, you've got a little combination of things going on. You've got a little bit of subtle textural change, a little crepiness in your skin. You've got some red areas in your skin. You've got some brown areas in your skin. I wanted to get you to do a variety of different things for your skin. First of all, I want you to see Jennifer, my esthetician, get on a good home skincare program. I want to start some lighter treatments on your skin using a combination of a couple different lasers. One is Fraxel, and one is a pulse dye laser, which is going to treat the redness, and that's going to tend to even your skin tone out, to make your skin much more rejuvenated. So to summarize, a little Botox here, around here. Gravitationally, you're good. Contouring an important area in certain places, and lastly, getting on a program for your skin.
Okay.
Ready to start?
Yes.
Okay, good. I want you to bite down nice and hard so you can really see that muscle here that's making that jaw really stick out, and bite down again hard. Okay. So you want to relax that muscle. So I'm using Botox right into the master muscle. That's going to help it to relax. And many patients, when they press left hand, when they're clenching to this degree, can start to really grind down the back teeth, get more of an overbite, and also contribute to TMJ issues. And you are a great patient.
Thank you so much.
And the Botox will work in a few days. You can notice those expression lines soften. The muscle, this chewing muscle, is going to start to relax a little bit. And as it relaxes, it's going to start to shrink down, and it's going to soften that lateral jaw fullness there and improve the facial shape. We just did a little bit of conservative contouring today with a couple different things. I'd like to see you back in about 2 weeks, see how it's doing, and possibly do a little bit more conservatively. We did the V-beam laser. I'm going to have you see my dermatologist, Dr. Adut, for some other laser treatment in terms of brown spots, and also see Jennifer, the esthetician, in terms of skincare program. Okay? And then we will finally get you going on the sculpture treatments to improve that stubborn little bit of disproportion in your midsection. Okay? But already looks much nicer. Let me give you the mirror and you can kind of see.
Oh, yeah.
It's already just that little bit is giving a little more of a lifted look to the face. Once it starts to soften here, your face is going to start having a little bit of a softer look and more of a heart-shaped look to your face. We'll get your skin dialed in, and these crow's feet will soften, and we'll get you on a more youthful track. Okay?
Thank you so much.
All right, Amron, take care.
Thank you.